Endometriosis is basically an inflammatory disease where cells from the endometrium or the lining of the uterus end up outside of the space where they're supposed to be. So if they migrate past that lining of the uterus, either into the muscle of the uterus or into other organs in the body, it can be pathologic and cause pain and sometimes bleeding and scarring. There are a lot of reasons why people can have pelvic pain, which is usually the reason why patients ultimately get diagnosed with endometriosis, is because of cyclic pelvic pain, primarily leading up to and around the time of their periods. So it's not going to be diagnosed initially when people start menstruating because it's usually not symptomatic right then. And periods can be very irregular and painful and symptomatic in other ways for the first 6 years after menstruation begins. Well, the good news is that hormonal contraception is the first line therapy for most people. Using hormones to suppress the endometrium or to suppress the ovary, which then secondarily suppresses the endometrium, are the best ways to prevent the endometriosis from being symptomatic. There are some other some types of hormonal contraception, primarily methods like the Depo-Provera injection, are actually strong enough that they can also cause some endometriosis to regress. So if somebody has lesions of those cells outside of their uterus, those spots, those areas can actually get smaller. Although endometriosis is associated with sometimes some challenges with getting pregnant, when people do get pregnant, and many do, generally speaking, the symptoms are reduced or eliminated during pregnancy because the hormones are different, and it's a state where progesterone is the primary hormone, which then suppresses the endometrium.